guys, it's Dr. Fai here. Today we are going to talk about glaucoma. So, what is glaucoma? Well, glaucoma is an irreversible cause of blindness. This happens when the nerve at the back of the eye, called the optic nerve, is damaged over time. And this is irreversible. You might ask this question, so doctor, what are the symptoms about glaucoma? Well, the scary truth is this. Glaucoma is mostly asymptomatic. This means that there's no symptoms until it is too late, where the vision or visual field is being affected. So what are the risk factors that contributes to glaucoma then? Well, the major risk factors include genetic, which means there's a family history of this disease, aging, and increased eye pressure. So how does increased eye pressure come about? Well, for that, we need to understand how the eye gets its pressure. Here's a look at the structure of the eye. Now, fluid within the eye is produced from this tissue here. As you can see, it flows in the direction of the arrow into this drainage area called the trabecular meshwork. Think of it like a drainage canal of the eye. So, high eye pressure comes about when the drainage area becomes too narrow or blocked. And in this case, it is called narrow angle or angle closure glaucoma. In a situation where the drainage area is open and the downstream drainage channels are unhealthy, this results in lesser drainage and therefore an increase in high eye pressure. So, how do we treat high eye pressure? Well, the main treatment options are laser, eye drops, or surgery. Let's take a look about lasers. A laser can be applied to this area to increase the outflow of the fluid and therefore lower the eye pressure. Medications work in the same way as well. They work by decreasing the fluid production and or increasing the outflow of the fluid, thereby lowering eye pressure. Last but not least, surgeries such as the minimally invasive glaucoma surgeries or implants can be performed by putting implants in the same drainage area. The implants are so small, they are even smaller than the tip of your fingers, as you can see here. Of course, if one requires a lowering of the eye pressure, there are also traditional glaucoma drainage or filtration surgeries which can be performed. Cuts can be made on the eye structure here, allowing a direct flow of the fluid within the eye to the outside of the eye. Similarly, implants with a tube can be placed which allow drainage of the fluid within the eye to the outside of the eye. This allows a drastic lowering of the eye pressure within the eye. So, what about glaucoma? If it's asymptomatic, what can we do? Well, detection. Early detection is the key. And how do we go about doing that? Well, if you have high risk factors such as family history of the disease or detected raised intraocular pressure or high eye pressure during any of those eye screening, do get your eyes checked by your eye care specialist, because early detection will allow us to slow down the disease progression with early intervention and hence preserving vision and preventing permanent visual loss. I'm Dr. Fai and follow me for more eye care tips.